Good evening and welcome to the COVID-19 update on Channels Television and Millicent Nwoga. First, the highlights. The Nigerian Medical Association in Yobe State is asking for a health bank as a cushion for health emergencies such as COVID-19. Edo State government urges residents to get vaccinated as quickly as possible in order to use supplies while viable. And the United States gets ready to open land borders with Mexico and Canada to fully vaccinated travelers. 310 persons were discharged last night after recovering from COVID-19 and no death was recorded. However, new cases were reported in 11 states, which now brings the number of COVID cases in the country to 208,153. Currently, almost 10,000 cases are active across the 36 states and the FCT, except Yobe State. Here's more on the virus update.
175 additional persons in Nigeria have tested positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT, indicating a decrease from the figures reported earlier. FCT logged the highest number with 73, followed by Lagos, which had 34, Rivers 15, Gombe 13, while Kano registered 10. Other states, including Plateau, Katsina, Bauchi, Delta, Benue, and Nasarawa registered a single-digit infection. The latest data includes a backlog of 120 recoveries from Edo, while Edo, Ekiti, Ogun, Osun, Ondo, Oyo, and Sokoto did not report any case. Nigeria now has a total of 208,153 confirmed cases. 310 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 195,936. Lagos is leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Oyo, and Akwa Ibom. There were no new deaths from COVID-19 complications in the last 24 hours, leaving the fatality toll to 2,756. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested. More than 5.1 million eligible Nigerians targeted for vaccination have been reached with the first dose, while over 2.4 million persons have been fully vaccinated. In Africa, there are more than 8.4 million confirmed cases, and over 214,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 238 million, while deaths are now beyond 4.8 million.
The Nigerian Medical Association is advocating the establishment of a health bank to cushion the devastating effect of COVID-19, as well as tackle the exposure of the health sector to other ailments. According to the chairman of the association, Dr. Nkanta Uwemedimo, the health sector has suffered monumental losses due to the pandemic in Nigeria. While lamenting the death of their colleague and infection of other health practitioners, the association is urging government at all levels to provide safety kits, effectively implement the National Health Insurance Scheme, and tackle brain drain head-on, especially in the COVID-19 era. He was speaking at a press briefing to commemorate this year's Physicians' Week.
The COVID-19 pandemic has greatly exposed the nation's poor health sector, with observable dilapidating health facilities and poor remuneration of healthcare workers. This has resulted in the call for a total overhaul of the nation's health sector, with the need to improve on financing the health sector in terms of budgetary allocations, effective implementation of the National Health Insurance Scheme, while enacting a law that will make the scheme compulsory for all Nigerians, as well as exploring alternative healthcare financing initiatives like the proposed Health Infrastructure Bank by the Nigerian Medical Association. It is also pertinent to track the release and use of a fund released for healthcare services at the federal, state, and local government levels. So I use this opportunity to urge all of us to continue to follow the established protocols, while also calling on the government to continue to provide the necessary safety kits for health workers, as well as a conducive work environment for healthcare workers.
And over in Yobe State, some residents have discounted fears surrounding COVID-19 vaccine, saying it is better to be safe than sorry. Those who are skeptical about the vaccine cite the reluctance of health workers in the state to take the jab as a reason for their hesitancy.
Yobe State recorded its first case of the disease in April 2020, and since then, government had continued to engage relevant stakeholders to ensure people are sensitized about the disease, especially in regard to prevention and control. So far, the state has received 121,010 doses of both the AstraZeneca and Moderna vaccines, and the exercise is still in progress, but some people are still skeptical about participating.
I know quite a few number of the health practitioners that have not been vaccinated. I'm not saying I'm not going to be vaccinated, but I'm taking my time. I want to see first.
Others say government would not bring vaccines to its citizens without being satisfied with its efficacy, and benefits come with being vaccinated.
We have seen our leaders. They came out before the camera. We've seen them, others that are not covered. We've had them talk on the radio. They have received vaccines, and they're okay.
There are many places that if you want to go, for instance, if you want to travel out of this country, if you don't have COVID-19, if you have not taken any jab of the COVID-19 vaccine, I don't think you can be able to leave the shores of this country, because it's one of the conditions. And it is good for us to take, because COVID is real.
The Executive Secretary of the Primary Health Care Management Agency in the state assures that the state is equipped to handle any adverse event that may arise after vaccination.
We ensure that anywhere that we are deploying our vaccines, we have already pre-positioned AFI kits to ensure that should anything happen, we are fully equipped and ready to ensure that we cannot say that there's no possibility of having adverse events following the immunizations, but that even if they do occur, we are prepared to tackle them.
Yobe State has so far recorded 502 confirmed cases of COVID-19 with 9 deaths, while only 3 people are on admission.
Panama today is administering the booster shot to people who received their second dose at least 6 months ago. Japan is to administer a third dose of COVID vaccine to people by December. Meanwhile, according to the Lagos State Commissioner for Health, it is possible that over time the original vaccine is not going to be effective against the mutating virus. So it's saying that we'll need to develop an updated and upgraded vaccine to protect everyone from the evolving and mutating strains of the virus. Well, joining us to talk more about the booster doses is Dr. Akiyala Ishaku. He's a virologist, and he joins us from Abuja studios. Glad you could join us on the program.
Thank you, Melissa, for having me.
Now, just yesterday, the Lagos State Commissioner for Health hinted at the possibility of booster jabs, another level of protection against the pandemic. But is this the time to be talking about this third dose or more doses when we don't even have enough to go around?
Melissa said it's not about talking whether we should have the next booster dose or not. The issue is that we don't have data. We don't have national data to support whether we need a booster dose or not. And so this brings to the national question, do we actually have a national data that will support the third booster dose? The issue is this, is that this is a 21st century that it is knowledge-driven, and data science is quite key when it comes to inform policy and decision-making. So as a country, we have not done a zero survey to actually establish what is the level of our immune response to the COVID-19 vaccine in terms of the first dose, in terms of the second dose. And so we don't have a national data to actually, pin down that. So I strongly believe that until we have a national data, this will go a long way to actually give us an informed position on whether we should drive a policy for a third dose or not. But I think even we are being compelled by vaccine hesitancy, what we need to do more is that we need to do a lot of advocacy so that people will do the buy-in into taking their jab, and so that we can be able to cover the WHO target of 70 to 80%. But I think as at now, discussing third dose may be immaterial. We need to actually see to how we can drive the vaccination process.
So a national data on the one hand, but how about on the premise that this is a virus that will keep evolving, keep mutating, therefore we need to upgrade the vaccination strategy needed for protection?
Yeah, absolutely. So I agree with him on that, because in the field of vaccinology, once you have a viral particle that mutates over time and also has different variants, it is expected that you come up with an improved version of a vaccine that is polyvalent in nature, that can be able to address different variants. So in the coming days to come, we shall be seeing an optimized, improved versions of COVID-19 vaccine that will be able to take care of the Alpha and the Delta variants, and even more new mutating variants that we're expecting in the future. But what it is quite key is that what is the level of our vaccination coverage? So the more we have a target of 70 to 80% vaccination coverage, the more chances of reducing chances of mutating variants that may emerge, and also will also reduce the number of hospitalization and the severity of the disease. So what we need to push forward as a country, as a nation, is on how to have a targeted 70% to 80% vaccine coverage.
But essentially with that, we need funding, and that is funding to acquire more vaccines.
Yeah, absolutely. We need funding to acquire more vaccine. I have been on this channel severally to provide solutions. Time has come for multinational companies that are in Nigeria to actually see to how they can be able to push for acquiring. So we have a lot of multinational companies. In fact, what stops us, Melissa, for a lot of our political elite, a lot of our political class to soar or to donate part of their take-home salaries for the procurement of these vaccines. We have a lot of well-being individuals, guys that are doing great, the likes of Aliko Dangote, the likes of great guys that are doing well in this country. We have a lot of multinational oil companies, a lot of multinational companies. So it is time for them to come together and to see to how they can be able to fund this. I am quite glad that Marlon Sanusi, Lamido Sanusi was in Lagos, and they are seeing to how they can be able to raise a 10 billion naira endowment fund for medical research in Nigeria. And I'm also quite happy that NMA is talking about raising a health infrastructural bank. Those are the thinking in the 21st century, and that is the direction we need to go. So in the coming days to come, we also need to see how we can be able to be manufacturing these vaccines in-house. It is quite key. It is long overdue. So I am expecting us to have a presidential vaccine initiative task force. We need to also see to how we can also raise vaccine ambassador. Melin said you are a potential vaccine ambassador for the push you have done for COVID-19 and the likes of many of your type that have pushed during this COVID vaccine. So we need to see how we can be able to reward you and begin to see how we can be able to come up with vaccine ambassador, people that can be able to become advocates for vaccine, not only for COVID vaccine, but for all childhood preventable vaccines. So this is the direction we need to go, and I think these are my prescriptions.
We'd like to thank you, Dr. Akiyala Ishaku, a virologist. Always a pleasure having you join us on the program, especially on a pandemic that we understand will still be with us for quite some time. Thanks a lot.
Thank you for having me.
Still to come on the program, Edo government is calling for better turnout as vaccines near expiration. Please stay with us. As part of efforts to ensure that residents stay safe and are protected from the coronavirus, the Edo State government says it is rolling out the second doses of vaccines in large quantities to rural communities. This is coming from the state's COVID-19 response team at the Irua Specialist Teaching Hospital. The head of the risk communication pillar, Edo COVID-19 response, Mr. Cruzo Osagai, disclosed this in Benin City, the Edo State capital.
I would say we are on the mark. We are pushing hard to ensure that we exhaust all the vaccines at our disposal as at today, before the expiration of the vaccines, before they expire. So that's why we're mounting more pressure to ensure that all the hard-to-reach parts of Edo State, we reach them, and then people in those areas get the opportunity to get vaccinated, and hopefully, by the grace of God, we'll be able to dispense all the vaccines we have in our kitty before any of them expires. Yeah, in fairness, we used to record far more number of deaths than this. This one case is relatively isolated compared to the way it had been a couple of weeks ago when we were recording multiple deaths on a daily basis. However, the threats of the virus are still there, they are real. We encourage our people to continue to observe the non-pharmaceutical prevention and all the protocols involved in preventing the spread of COVID-19. We also encourage all our citizens to take advantage of the vaccination exercise and get vaccinated, because this is a more sustainable way to prevent this virus from continuing to ravage our population.
Mr. Cruzo Osage speaking there in Benin City. Now, away from Nigeria, the pharmaceutical firm Merck announced last week that an antiviral pill it's developing can cut hospitalizations and deaths among people with COVID-19 by half. The results haven't yet been peer-reviewed, but if the drug candidate Molnupiravir is authorized by regulators, it would be the first oral antiviral treatment for COVID-19. Well, talking about more on the drug, joining us right now is Dr. Peter Imoesi, Research Fellow, University of Aberdeen. He joins us from Scotland. Thank you for joining us on the program.
Thank you for having me.
So tell us, how does this antiviral pill become the game changer in the fight against COVID-19?
I think in some quarters, it's regarded as the game changer because, one, it's a single pill. You just need to take it as oral dose. That is one. Then two, it has the capability to interfere with the genome of the SARS-CoV-2 virus, thereby leading to reduction or preventing replication of that particular virus, which is the SARS-CoV-2. Then also, you can take the drug as well within a confined or within the comfort of your home. So in that regard, you will say, yes, it's a game changer. Then on the other route, we know that it's one of the first oral pill for SARS-CoV-2 virus we know at the moment. Then also, I think in my own opinion, when you say it's a game changer, then you have to look at the other way around, where we know that for you to get onto this particular medication, if you're a childbearing woman, you need to test for your pregnancy first to ensure that you're not pregnant before you can get onto this medication. Also, you need to do a PCR test to confirm if you're positive before you can get onto the medication as well. So on two sides, one is a game changer. On the other side, there are little bottlenecks here and there before you can get onto the medication.
And perhaps these are some of the things it will go through about its safety and efficacy before a decision is made by the US FDA.
Yes, based on the interim data we saw, based on the press release from Merck, we know that people who were on the placebo arm, they are three times more likely to withdraw from the trial compared to individuals who were on the drug itself. So when it comes to safety, I checked on the clinical trial.gov website where drug companies do register their clinical trials. And I was able to see that the phase 1 and phase 2 clinical trial experiments were actually recorded in that particular website. So for the safety, I think Merck are actually working on that as well. Now, when it comes to the efficacy, based on the press release, we were also told that it holds against the current variants we have, which is the Delta variant, the Gamma, and the Mu. So when it comes to the efficacy, it's holding against those sort of variants in circulation at the moment.
But Dr. Imoesi, the makers of the drugs specifically asked the FDA to grant emergency use for adults with mild to moderate COVID-19 who are at risk. I mean, does that mean it's a different outcome for severe cases or those who are at risk for severe case of COVID-19?
I won't regard it in that light because one, before you get to the level of severity, you know that there are 3 other outcomes you need to go through first. 1 is asymptomatic, 2 is the mild, 3 is the moderate. So before you get to the level of severe, it means that you have to go through these 3 stages. And from the data we saw from Merck, we are aware that when it comes to hospitalization, this particular medication do have the capability to cut that by 50%. So if this medication do have the capacity to reduce hospitalization, it means that the road to severity will be cut short by 50%. So for those within that particular, let's say, bracket of severe cases, then you have a limitation there. Also, don't forget, we also have the vaccines with the capacity to also limit severity, hospitalization, and death. So it's a little bit kind of complicated, but both the medications and the vaccines do have the capability to stop severity as well.
Where does the World Health Organization stand in all of this?
I saw the press release from World Health Organization yesterday, and I think their points are valid. First, I think Merck should go ahead to make available their clinical trial data, both the phase 1, phase 2, and phase 3, which is necessary for transparency. Then they should go on to publish these same findings in a peer-reviewed journal as well, because that is the way science is done. Then secondly, I also read in the Merck press release where they said they are actually in communication with drug regulators around the world. So if you are going through that particular route, then you need to carry along the WHO, because that is a world platform when it comes to response to pandemic and other global health issues. So I think WHO are actually on the right trajectory. That is one. Also, we know that when it comes to the cost for the molnupiravir drug, is somewhere around $700 US. So World Health Organization should be able to regulate the cost price and the availability of this particular medication to low and middle income countries. So I think it's a welcome development for World Health to demand for those clinical trial data as well.
Finally, I mean, looking at other therapies which we've had, if you recall, the antiviral remdesivir, and there's also the cocktail from the firm Regeneron. Where does that put, this particular pill from Merck?
So I'm not going to really relegate those 2 medications from monoclonal antibody and remdesivir, because when you look at the pandemic, these sort of medications have actually played a role in the response to this particular pandemic we're in. Also, the only downside to those medications is that you need to administer that medication through intravenous injections. That is just the downside to those drugs. Also, with the remdesivir, we know that once that particular drug is administered within the first 3 days of the onset of the disease, it's actually very promising at limiting the rate of severity and death as well. So those 2 drugs have actually held their ground in the era of COVID-19 pandemic. Whereas when it comes to the Merck, we know that it's just a tablet, it's just a pill where people could literally take that within the confine of their home. That's just the difference. But when it comes to the 2 platforms, I would say both are necessary in terms of responding to the pandemic as it were at the moment.
So quite hopeful, another tool in our toolbox to fighting the pandemic. We appreciate your time. Thank you so much. Dr. Peter Imoesi is a research fellow, University of Aberdeen. Thanks for joining us.
Thank you for having me.
And many travel sites across Singapore have crashed as tourists rush to purchase tickets following news that from October 19, vaccinated people can travel freely from Singapore to a dozen countries around the world. And this is without quarantine and with fewer swab tests. 9 countries will be added to the list by November 15. Also, reopening borders is the United States. Let's take a look at the global update.
The United States is set to reopen its land borders with Mexico and Canada to fully vaccinated travelers from November. It means those sailed out of the US because of the pandemic can enter for any reason using land and ferry crossing points. Air travel is allowed with a negative COVID-19 test. Meanwhile, a Texas judge has temporarily put a stop to United Airlines placing employees on unpaid leave if they have received religious exemptions for COVID-19 vaccinations. The order will remain in place until October the 26th. Away from the United States, the French government plans to ask lawmakers to extend its pandemic state of emergency until July the 31st next year to deal with the continuing coronavirus crisis. The state of emergency extension would mean that the government will keep the power to extend or reinstate restrictive measures, such as the use of a health pass, to gain access to venues such as restaurants, bars and cinemas. The current state of emergency and the requirement of a health pass are due to expire on November the 15th.
Il y a encore, nous le savons, un risque non négligeable de reprise.
And in Italy, public and private employees will need a COVID-19 health certificate to go to work as of Friday. Officials approved in mid-September some of the strictest anti-COVID measures in the world, making it compulsory from October the 15th for all workers either to show proof of vaccination, a negative test, or recent recovery from infection. The Green Pass certificate is already a requirement for entering venues such as museums, gyms and restaurants. Over 80% of Italians over the age of 12 are fully vaccinated. And finally, Russia has reported a record daily rise in coronavirus-related deaths for the second day running, amid a surge in COVID-19 cases and deaths that has led the Kremlin to demand that authorities speed up the pace of vaccinations. Russia's coronavirus task force reported 984 coronavirus-related deaths, the highest single-day death toll since the start of the pandemic, as well as 28,717 new infections in the last 24 hours.
Don't forget to wear a face mask when in crowded places. Continue to take responsibility. You can take a look at our website. It has more updates, also breaking stories. It's channelstv.com. It's news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.